Hello, today's lesson is ST segment, characteristics of normal ST segment and abnormality of a ST segment. What are the characteristics of normal ST segment? It is the isoelectric line. That means it starts from the end of S to the beginning of T. It represents the beginning of the ventricular repolarization. What is the actual repolarization? Is the T wave. It is the beginning of ventricular repolarization of the ST segment. Normally, it is an isoelectric line. ST elevation is normal up to 1 millimeter in lymph node and 2 millimeter in chest field. If it is more than 1 millimeter in lymph node and it is more than 2 millimeter in chest field, that is mean the abnormality of ST elevation. That is abnormal ST elevation. What are the normal ST segment depression? Up to the 0.05 millimeter. That means if ST depression is more than 0.05 millimeter, it is abnormal ST segment depression. In which lead in ST elevation is important is the lymph node and chest tube. In which chest tube is the B1 and B3. Why it is B1 to B3? Why not is B4, B5 and B6? If ST elevation is B4, B5, B6 is not associated with other change that is in the pathological treatment patient and the patient is young, that we think early reproduction or high takeoff. Now let's go for the abnormality of ST segments. ST segment is ST elevation, abnormal ST elevation, abnormal ST depression, early reproduction or high takeoff. What are the causes of ST elevation? ST elevation. What is the abnormal ST elevation? That means the greater than 1 millimeter in lymph node ST elevation and 2 millimeter in the chest. What are the causes? Recent myocardial infarction, acute pericarditis, metal angina, ventricular aneurysm, early reproduction, and hyperkalemia. What are the causes of ST depression? That abnormal ST depression, that means that below the isoelectric line, more than 0.05 in any layers. What are the causes? Acute myocardial infarction, ventricular hypertrophy, digoxin effect, not digoxin toxicity, acute postural myocardial infarction. Look at this true postural myocardial. It is the acute myocardial infarction, but there is ST depression. That's called the mirror change. Mirror change is the abnormal form. What are the mirror change? The right side is left side is the right side. If we put letters on it and in mirror, it is the upside down or the reverse image. That means in MI we get the ST elevation, and here two posterior mirror images they get ST depression and associated dominant upper all and tall upper T wave. In early reproduction with the high takeoff is the ST elevation. It's the ST elevation, no T wave change, no pathological. It's a normal, benign, young male, black males. ST elevation is B4, B5, and B6 as is the jaw point elevation. It's a normal finding. It may confuse with the acute myocardial infarction, acute pericarditis. How can we differentiate detailed history, serial ECG, and compare with the old ECG?